Borderline personality disorder, BPD, is a complex and often misunderstood mental health condition that affects millions of individuals worldwide. Characterized by pervasive instability in mood, self-image, behavior, and interpersonal relationships, BPD presents significant challenges for those who live with it. In this comprehensive exploration, we will delve into the multifaceted nature of BPD, examining its symptoms, potential causes, diagnostic criteria, and available treatment options. Borderline personality disorder is marked by intense emotional dysregulation, leading to frequent and intense mood swings. Individuals with BPD may experience episodes of profound sadness, anger, anxiety, or emptiness that can escalate rapidly and feel overwhelming. These fluctuations in mood contribute to difficulties in managing impulses and controlling behaviors, often resulting in impulsive actions such as substance abuse, reckless spending, self-harm, or suicidal behavior. Another hallmark feature of BPD is instability in interpersonal relationships. Individuals with BPD often struggle to maintain stable and healthy connections with others, characterized by patterns of idealization and devaluation. They may form intense, but unstable, attachments to others, only to quickly become disillusioned and push them away. This fear of abandonment and rejection fuels a cycle of turbulent relationships, making it challenging to establish and maintain lasting bonds. The symptoms of borderline personality disorder can vary widely among individuals, but they typically encompass several key areas. One significant aspect is the disturbance in self-image and identity. Individuals with BPD often struggle with a fragmented sense of self, experiencing uncertainty about their values, goals, and identity. This lack of a stable self-concept contributes to feelings of emptiness and a pervasive sense of inner turmoil. Additionally, impulsivity is a common feature of BPD, manifesting in various behaviors such as reckless spending, substance abuse, binge eating, or risky sexual behavior. These impulsive actions often serve as maladaptive coping mechanisms to alleviate emotional distress or fill a sense of emptiness. However, they can lead to adverse consequences in various areas of life, including financial, legal, and social domains. Furthermore, individuals with BPD may engage in self-harming behaviors as a means of coping with overwhelming emotions or seeking relief from inner pain. Self-harm, including cutting, burning, or hitting oneself, serves as a temporary outlet for emotional distress but can have serious long-term consequences. Moreover, suicidal ideation and suicide attempts are common among individuals with BPD, highlighting the severity of their emotional suffering and the need for timely intervention and support. The causes of borderline personality disorder are complex and multifaceted, involving a combination of genetic, environmental, and neurobiological factors. Research suggests that individuals with a family history of BPD or other mental health conditions may be at an increased risk of developing the disorder themselves, indicating a potential genetic predisposition. However, specific genetic markers associated with BPD have yet to be identified. Adverse childhood experiences, such as trauma, neglect, or invalidating environments, are also significant risk factors for the development of BPD. Early life experiences shape the neurobiological and psychological functioning of individuals, influencing their ability to regulate emotions, form healthy attachments, and develop a stable sense of self. Chronic exposure to trauma or neglect can disrupt the development of essential coping mechanisms, leading to maladaptive behaviors and emotional dysregulation later in life. Neurobiological factors, including abnormalities in brain structure and functioning, also play a role in the etiology of BPD. Studies have identified alterations in areas of the brain involved in emotion regulation, impulse control, and interpersonal processing in individuals with BPD. Dysregulation of neurotransmitters such as serotonin and dopamine may further contribute to the emotional instability and impulsivity characteristic of the disorder. Environmental stressors, such as chronic interpersonal conflicts, major life transitions, or invalidating environments, can exacerbate symptoms of BPD or trigger episodes of emotional dysregulation. High levels of stress or adversity can overwhelm individuals' coping mechanisms, leading to increased vulnerability to the development or exacerbation of BPD symptoms. Additionally, societal factors such as stigma, discrimination, and lack of access to mental health resources can further compound the challenges faced by individuals living with BPD.